questions, and I'll kick things off in a moment with introductions.
We're live.
Okay. Okay, so we will get started. Thanks to everyone for joining us today. We're going to hear some updates from Regional Chair Karen Redman, as well as Acting Medical Officer of Health, Dr. Hsiu-Li Wang. First up, Regional Chair Karen Redman will provide us with a brief statement and some tips about how to maintain good physical distancing during this Easter and Passover weekend. So I'll now turn it over to Chair Redman.
Thanks, Julie, and thank you all for joining us today. I'd like to start by expressing my condolences for those who have lost loved ones to COVID-19. Holidays are especially difficult when grieving the loss of a loved one. My sympathies go out to those who are ill and for those who are worried about loved ones who might be vulnerable. I want to assure you that the region, together with public health, are doing everything we can to reduce the spread of COVID-19 in our community. For those who are trying to find ways to mark celebrations this month like Passover, Easter, Ramadan, Basaki, and Redman, I hope you will find ways to connect with your family and friends while keeping safe. Connect online with friends and family. Find an online chat group with those of your faith group or place of worship. Make a telephone call. I have two sisters. One lives in Rochester, New York, and one in Eris, and we've been sharing memories and old photos of past family celebrations with each other to celebrate through remembering. And lastly, we cannot stress this enough. I know this has been mentioned earlier this week, but we still see overcrowding at local parks and trails. The safest thing to do at this stage of the pandemic is simply to stay home. Crowded trails and forests and parks reduce your ability to maintain proper physical distancing, including busy parking lots. For those who feel they need to walk outside for physical or mental health and well-being, please adhere to the public health guidelines. Those guidelines are, when walking in a park or anywhere, residents should always practice 2-meter physical distancing guidelines. Avoid crowding and don't travel to parks or trails, particularly by car. Residents who do not live near a trail should walk within their own neighborhoods. Residents should not plan activities at parks, and this includes gatherings of any kind, picnics or sports events. Always wash your hands immediately upon returning home. I hope you can find ways to make the best of this holiday weekend. Thank you again for everyone who is doing their part to stay home as much as possible. We will get through this together.
Thank you, Karen. We will now hear from Acting Medical Officer of Health, Dr. Hsiu-Li Wang, who will provide an update from public health, including some modeling forecast information, a change to our dashboard that she wants to highlight, as well as further tips for safely enjoying this weekend. Dr. Wang? We'll just get you to unmute your mic.
Okay, thank you. Thank you everyone for being here. So I'd like to start with an update in regards to projections. So this will be a somber update. First, I'd like to say models cannot predict what will happen, but models can help us understand what could happen to help support decision-making so that we can plan actions that will enable better outcomes. All models have limitations. And as with any model, the further out predicted, the more uncertainty there is in the predictions. I will present modeling forecasts regarding the number of deaths we could see in Waterloo region based on the modeling projections released by the province. The projections released by the province were developed by several experts at Ontario Health, Public Health Ontario, and researchers at Ontario universities. I will give some provincial numbers as context, and then I will talk about the Waterloo Region numbers. Projected rough estimates of the number of deaths over the course of the pandemic. Projected Ontario deaths in the absence of public health measures, 100,000 deaths. With public health measures, up to 15,000 deaths. Projected Waterloo Region deaths. In the absence of public health measures, roughly 4,100 deaths. With public health measures, up to roughly 615 deaths. Public health measures preventing 3,485 deaths. Projected number of deaths by April 30th, which is in 3 weeks. I'll start with Ontario numbers again. Projected Ontario deaths in the absence of public health measures, 6,000 deaths. With public health measures, up to 1,600 deaths. And now in Waterloo Region, in the absence of public health measures, roughly 246 deaths. With public health measures, up to roughly 66 deaths. With public health measures preventing approximately 180 deaths. In addition to being very rough estimates, which are not meant as predictions, but rather as projections to support decision-making, these are also point-in-time projections. Ontario will continue to refine its models, and we will continue to update our local modeling as a result. Now I'll provide a bit of a status update and let you know of a change to our dashboard regarding number of negative tests. We now have 242 positive confirmed cases in Waterloo Region, of which 77 cases are now resolved. And locally, we have tested 2,792 individuals. Public Health Ontario Lab is no longer sending reports of negative tests to public health units. The province is transitioning to making it possible for people to check their COVID-19 results online at covid-19.ontario.ca. Because we will no longer receive reports of negative tests from labs, our dashboard will no longer report the number of negative tests in the region starting today. Region of Waterloo Public Health will call all people with positive COVID-19 tests to inform them of their results. We will no longer be calling people to inform them of negative results. And finally, some words regarding Easter and Passover. For those who celebrate, this is an Easter and Passover experience none could have expected. Easter and Passover are precious moments in the calendar for those who celebrate and that are often shared with members of their wider families. But unfortunately, this cannot be our experience this year. That's because we know the most effective ways of slowing the spread of COVID-19 are to stay at home and to practice physical distancing. So this means celebrating Easter and Passover only with members of our own households. If we relax our measures, if we let up our guard, even momentarily, this can and will lead to an escalation of cases and an escalation of deaths in Waterloo Region. This will also undo all the good work we have done so far by those practicing physical distancing and staying at home when they can. So as you celebrate Easter and Passover, please continue to keep these things in mind. Continue to celebrate with members of your family, but virtually. And thank you to all who have celebrated the Seder last night while maintaining physical distancing. As we continue with our measures and as we move through these important milestones in our calendars, birthdays, anniversaries, and various other celebrations, we know that many of you want to know when this will be over. But the reality is we do not know yet. These measures are very difficult, but they are absolutely necessary. This is a moment in our lives that none of us will forget. In years to come, let us remember this time for having worked together and for having done the best we could for ourselves, for our loved ones, and for those most vulnerable in our community. Thank you again to everyone who has been making the efforts that we're asking of them. We know it has been very hard, but your efforts have been having an impact, and we appreciate it very much. Thank you.
Thank you, Dr. Wang. We'll now move to questions from our media partners, and we'll start with Krista from CTV.
Hello.
Hi, Krista.
Hi. So our question are for yourself, Dr. Wang. We're wondering how many COVID-19 tests has the region been doing each day over the last several weeks?
I don't have that number because it's not the region. I mean, it was posted on our dashboard and it will continue to be posted every day, the number of new tests. The tests are happening at the hospitals, in their assessment clinics. So we're not actually doing that. So we gather all the info every day and then we post it on our website. So I think you could potentially track it by looking at the daily increases on our website.
So then on that note, what is our capacity for testing? Because we have heard some reports that the province hasn't been meeting their full potential.
Yes.
What does that look like locally?
That's a very good question. Thank you. So very recently, we have been able to access an increased number of testing kits. We have acted upon that increased availability immediately, so that those kits are coming into our region now. And with our healthcare partners, we have made plans to increase testing. In fact, that increase in testing is starting today. Yesterday, the province released some updated guidance with respect to testing that focuses still on priority populations, such as those in long-term care homes and retirement homes, but expands further on them. So because of that, is that me or somebody else who's not muted? Anyways, so because of that, we are continuing to expand the testing in those settings, and it's starting today. We are going to take advantage as much as possible of all the increased testing capacity that Ontario is in the process of making happen.
Do we have an exact number though of how many tests are available here in Waterloo Region on a daily basis?
No, because it will depend on the amount of test kits that we're able to get, and the groups that the province has identified as priority for testing. But what I can tell you is that based on the increased supply of testing kits that we're getting and the increased capacity that we're in the process of putting in place, we are going to be able to meet the testing for the priority groups that the province has set out, which continue to be focused on those vulnerable groups for now. Ontario is continuing to work on their testing strategy, and that may expand in the next days. We don't know what that expansion could look like, but we know that the priority right now is to continue to focus on those groups that are more vulnerable, like those in long-term care homes, and we are doing that now.
To clarify though, are we meeting our potential, or are we are we having tests left at the end of the day, or are we turning?
No. We're in the region. We are going to meet our potential. We are getting increased number of swabs. We are doing immediately increased testing. So we are meeting our potential based on what we get from the province.
Okay, you spoke about the long-term care homes, the new guidelines that have come out from the province, as for testing and who would be a priority of testing. When will those, do we know exactly when those will be implemented here in our long-term care homes in Waterloo
They're
region?
being implemented starting today.
Okay.
We got the guidelines yesterday. They're being implemented today. We worked 24/7. We're working 24/7 with our partners, and yeah, immediately implementing them.
Okay. Do we have any, there was a new death listed this morning. Do we have any details that you can release on that?
Yeah, so what we know is that in the last, for the last few deaths that we've reported, these were in people who were over the age of 70 and who had other medical conditions.
So this morning's person was over the age of 70 with a prior health. Okay.
Yes, prior health conditions.
Okay, I think that's it for my current questions. Thank you very much.
Thank you.
Thank you, Krista. So I'll just remind everyone to keep yourself on mute when you're listening, just so that we don't get the feedback. We'll move on to Chris from The Record. Chris, go ahead.
Hi, Dr. Wang. I wonder if you could comment on looking at the cases over the past week. There seems to be healthcare workers and people over 70 are most at-risk groups. I'm wondering if there's what we can do to better protect these two vulnerable groups.
That's an excellent question, Chris. So one of the reasons that we have a high proportion of test results that are positive among healthcare workers is precisely because they have been one of the priority groups. There's been limited testing to date. They have been one of the priority groups, and we have maximized testing in healthcare workers. Because of that, I'm not surprised at all to see the proportions that are on our dashboard. It is a good thing to know, because testing in those prioritized groups can change what we do with these people, right? For healthcare workers, it has an impact in terms of when they can work and how they can work and things like that. So that, I would say, is a reflection of the increased testing among healthcare workers. Regarding those that are in long-term care, we have seen across Ontario, and we see now in our region, that is a very vulnerable setting, and that the what we call the case fatality, or the number of people who die once they've gotten the disease, is highest in those that are 70 and over and older, and who often have other health conditions. So that is one of the reasons that testing now has been even further expanded among this group of people in those settings, and among the healthcare workers that work with them. So we're going to see increasing numbers of cases in long-term care homes, increasing number of cases in healthcare workers. That's just going to continue to rise. Sorry, Chris, I can't hear you.
Oh, can you hear me now?
Yes.
Okay, thanks. If we have a second question that's unrelated, do we do another round again, or should I ask it now?
Go ahead, Chris.
Okay, this question is relating to a study posted out of the Netherlands. It mentions the distance between joggers and cyclists may be better if it's not, if two meters may not be enough, is what the study suggests. And I'm wondering if you could comment on that, Dr. Wang.
Yeah, so, there's a lot of studies coming out at this time. A very, very big number, right? And so what's being done right now is expert bodies at the provincial and federal levels who are tasked with this type of work are looking at all the studies, are looking at what the body of evidence says, and they are coming out with recommendations for the public, for us, local public health units as well. And based on the best available evidence that we have to date, we believe that 6 feet is a conservative and good distance for people to maintain to maintain distance from others. That's based on what we know of the transmission of the virus, which is in the form of respiratory droplets. And if somebody is very sick and they're coughing and they're sneezing, a lot, the droplets can fly in the air, but they don't go farther than 6 feet. So that's the basis of the 6 feet recommendation. And it's still the best evidence we have at this time.
Okay, and just to clarify, that includes for someone who is out for a run, if someone were to be behind them 6 feet, that is still a safe distance.
Yes, yes. 6 feet is when somebody is really symptomatic and coughing and hacking. And so, yes, if you're 6 feet with other people, that's a safe distance.
Moving or otherwise.
Yes, correct. Moving or otherwise. That's correct.
Thank you.
Okay, is there any other questions, Chris? Are you good? Okay, we'll move on to Irene from Air News. Go ahead, Irene.
Thank you. We know that there are healthcare workers, especially in long-term care homes, that travel from home to home to work. Has there been any spread of COVID because of this, or is there a concern that this needs to stop?
So there's kind of two things that need to be balanced in those types of situations. The need for homes to have workers. So with COVID-19 impacting these homes and impacting the workers in these homes, there are less workers. There is a need for more workers actually in these homes. And so there is no recommendation that people can, or rather people have to only work in one place if there's no outbreak. So there are very strict measures now that have been implemented in these homes for anyone coming to work in these homes, right? They have to be screened. They have to put on personal protective equipment. They have to have their fever checked twice a day. So, or sorry, not their fever, their temperature. So there are very strict measures to screen people before they even start to come into the facility, even the workers. And in addition, there's a need for these workers in homes. There's a greater need now than before. So we have to keep the system running. We have to make sure there's sufficient care for the people while we make sure that the care is given under safe conditions. If a home is an outbreak, then there is no further movement of workers that is generally permitted. That's true.
Thank you. Are these measures only in Waterloo Region, or is this a provincial?
No, these are provincial guidance. This is provincial guidance. Yes.
Great. Okay, I have a second question, if that's okay.
Sure.
This isn't to do with the public health in particular. It's to do with Waterloo Regional Police, and I'm just wondering, how many, if there have been any charges laid for gatherings. We understand there could be one assault charge laid. I guess I'm wondering if there are any plans to bring Chief Larkin into these meetings, or if this type of information is being made public.
Mike Murray, our CAO, who's not here with us today, he has been answering enforcement questions. And, I'll just kind of reiterate that the principle is, we are doing active monitoring. So when I say we, that includes the police, public health inspectors, regional bylaw, regional security, area municipal bylaw. We have a very excellent collaboration between the many different enforcement forces. And, we're doing active monitoring. We're responding to complaints. We're following up. And we're doing what's called progressive enforcement. So, if we feel that education and letting people know, that they're not supposed to do something, or giving them a warning isn't sufficient, based on the judgment of the enforcement officer, they will proceed to active enforcement to date. We've had a few instances of active enforcement, and so I don't have the numbers, but they were the ones that were reported previously. In addition, since the update on Wednesday, there has been an additional charge, one additional charge of one business, and that's with the usual set fine of $750. So we, the goal is compliance, not necessarily. It isn't. We have to, and so that's kind of the overall in terms of enforcing and
that's
compliance
great.
and enforcement, I would say.
Okay. I guess I just think it might be helpful, for instance, being in air, if I knew that there had been a charge of a gathering, it might make a difference for people who are deciding to go for a walk. So knowing whether or not there have been people in your community might be helpful. And I just wondering if there are any plans to post this information.
Yeah.
Okay.
Yeah. So we'll take that back. But I just want to clarify that people can take walks. It's not that we're prohibiting walks. We're asking people to stay at home, but they may need to go out for essential errands, and they may feel the need to go out, for example, for a walk, for their mental and physical health. And we recognize that people will do that, which is why, Chair Redman is wanting to speak on that. Thanks.
Thanks, Hsiu-Li. I was just going to underscore what you're saying. And, Irene, everybody needs to assume, because this is community spread, that they need to continue to keep the 6 feet of separation between them and other people, whether they're going for a walk. Everybody should assume that this risk is something that can happen anywhere in the region. I don't think it's just about enforcement or how many tickets that are written. And those, as Dr. Wang have said, have been fed through this briefing, and the control group is definitely monitoring that. But people in the township should assume that it's a real and present a threat, just as it is throughout our community, if you're not adhering to the guidelines of public health.
Okay, thank you.
Thank you, Irene. Next up, we'll hear from James at 570. Go ahead, James.
Thank you. My question has something to do with long-term care homes and testing positive. And it has mostly to do with employees. So is there any precautions provided to employees if they ever have any symptoms of COVID-19, or if they, for some reason, test positive for COVID-19?
Yes, absolutely. There are a lot of different things that need to happen in a long-term care home, but of course, ensuring that employees, like I mentioned earlier, everyone is screened, before they come into the home. They wear appropriate protective equipment, such as masks, and they are not to work the moment that they begin to have symptoms. So those are the types of measures that we require and enforce for healthcare workers in long-term care facilities, especially during an outbreak.
And have we had any solid amount of numbers of employees that might have been tested or might have tested positive for COVID-19 at all in long-term care facilities in our region?
Yeah, if you look on our dashboard, don't know if this is your question, but if you look on our dashboard, we actually provide a lot of info every day on the numbers among residents and staff, as well as the number who have passed away. So that gives a good indication. There's a lot more testing than that. I won't have the real-time numbers because that happens on a real-time basis. And, there's a lot of clinical assessment that goes on based on the guidelines by the long-term care home physicians and nurses. And so I won't have the exact numbers, and the dashboard isn't real time anyways. But I can tell you that a lot of testing is going on. And in fact, starting today, even more testing is going on. So in the next weeks, we are going to see a rise in our curve because we are going to see many more test results coming back from patients and from healthcare workers. And I suspect we're going to see more cases as well.
And personal protective equipment has been one thing that that we've been trying to get more of. Do you know if there's any work being done, behind the scenes to get more of that in our communities and into the workers that that are directly working with people who might have symptoms or who might have tested positive for them to stay safer than what they are now?
Yes, James, that's a very good question. So there has been an enormous amount of work that's been happening, through the supply chain partners. It's it's one of the very top priorities of the provincial command table and of all the Ontario health regions, of which we're a part of Ontario Health West, and so I sit at the leadership table for that as well. And that's a very active topic of discussion, and we're starting to see progress. Very recently we started to see some increased availability of supplies. It's still limited. It's still something for which we absolutely must continue to practice stewardship of. It may not be what healthcare workers are necessarily used to in times when there were no limitations on supply, but expert bodies have weighed in on what is required in terms of supply and in terms of equipment for healthcare workers in order to protect them and their patients, even though there's a limitation of supplies. So those bodies have come out with that guidance, and that guidance has been put out to all all healthcare organizations, facilities that use PPE or personal protective equipment. And the important thing is that two things, supply is continuing to be worked on. We have seen some improvements recently. We hope that continues, but it's still limited supply, and we still need to practice good stewardship of those supplies. But it's an ongoing thing, and we'll keep at it.
And I don't know if you would know this, but I'm just going to ask just in case that in the chance that you might,
Okay.
any of the local companies that have been helping with protective equipment and stuff like that.
Yes.
Do we have a number of companies that are helping right now in the region, and how much equipment they've been able to provide in that way?
Yeah, so that's a very good question. We have had a very, very large amount of offers from local companies and other, groups that have wanted to donate things. And so those donations or those companies' offers are being centralized through bodies like Ontario Health and Ontario Health West and the province as well. So we are not the bodies that are centralizing this type of stuff. We're actually in public health not involved in the supply chain per se. And so what we do is when we get those types of offers, we refer them on to the right channels across the province that are centralizing this and taking up responding to these offers and assessing whether they can meet our needs.
Okay, thank you, Dr. Wang.
Thank you, James.
Thanks, James. We'll move on now to Paula at CBC.
Oh, hi, Paula.
Hi there. Can you hear me okay?
Yes.
Okay, great. I just wanted to ask, on your dashboard, there is a new deceased case that is showing at Forest Heights, Rivera. Is that the same person who is the latest deceased case, that 9th person?
I'll be honest, I'm not, there's a lot of numbers that flow in. And so what I do know is that the latest deceased cases are people that are over the age of 70 and who have been, who have other medical conditions. I'm not sure if that one is number 8 or number 9. I'm sorry, I don't have that exact precision for those. And I probably won't have going forward.
Okay, fair enough. But you can confirm that we are at 9 deceased cases, and then of those, 3 deceased at Highview, 1 deceased at Forest Heights.
Yes, that's a very good question. So I just want to emphasize, it's written on the top of our dashboard, but because of the very, very high number of, cases that are coming in and all kinds of information that is coming in, the data that is on our dashboard is good as of 7 p.m. the evening before. We continue to work around the clock like our healthcare partners, but so the actions don't stop, but the counting needs to be counted once a day. There needs to be a cutoff to be able to ensure quality results. So the numbers you see on the dashboard are good as of 7 p.m. the evening before, and if there are new numbers, they'll be on the dashboard on the next morning's refresh.
Okay, fair enough. I think that does it for me then.
Okay, thank you, Paula.
Okay, thank you, Paula. And Kevin, do you have any questions for us? Kevin from Global.
Yeah, I wanted to ask about the modeling.
Yes, sure.
So there was 2 numbers given, for example, for April, 246 and 66. The 66 number, you said that was based on public health measures. Is that current public health measures?
That's correct, Kevin. It's a good question. It's current public health measures.
Okay, so going forward, we're going to see it, obviously that number rise dramatically. Have we figured out when there's sort of, does the model show where there might be a peak in numbers at the moment? Like, is there a guesstimate or no?
No, there's no estimation at this point from the province either about when the peak will be.
Okay.
You generally, for epidemics, I can tell you, Kevin, we know when it's passed. We know that we've had a peak after it's passed. So I don't think it's going to be different for this epidemic either. And again, we continue to do things to try to have an impact on the spread of the disease. And so what we're hoping for is obviously to continue to prevent every unnecessary death that we can. But, it's important, as you know, to sort of let people know, now that the province has come out with some modeling, how does that apply to our region, what we could potentially see. But I caution again, this modeling is very rough, and it's only meant as a projection, not a prediction.
Okay, so the province has changed to not give you guys or notify you guys when a case comes back negative. Is that not?
That's usually the case. That's usually the case with lab results. People don't usually get the negatives, but in the beginning they have been providing a lot of negatives. Yeah, sorry to cut you off. Please go ahead.
Yeah, is that not going to affect your modeling going forward?
No, because the modeling is based on positive cases, and the modeling is based on deaths, which actually are not dependent on numbers of cases detected. So no, because we still have the numbers that are positive.
Okay, thank you.
Thank you.
Okay, we've had a lot of questions today. Does anyone else have anything that they missed? Chris?
Yeah, if I may, and I'm not sure if you'll be able to comment on this or not, but from the numbers that are posted as of last night at 7 o'clock on today's portal, it shows that there was an increase in staff, cases in staff at the Forest Heights long-term care home. And I'm not sure if you can comment on that. It seems to be a jump from the previous numbers of 6, now 11, with it. A new deceased, it looks to be there. So I wonder if you could speak to that application.
Thanks, Chris. Yeah, so this is what we actually expect to see actually when we have a COVID-19, sort of enter a facility. the usual path is that it will start to spread very quickly. And we put in place measures as soon as we can to try to slow the spread and prevent future cases. And so it's actually what we expect to see. What I'm actually happy to see is that for a number of other homes, this hasn't happened. So it's kind of a good thing that, we're detecting early, and we're trying to minimize, and we are minimizing spread where we can. This will normally happen in long-term care settings where there's going to be an increase. And what we hope to see is that, especially with the increased testing that is starting today, because we've now got increased testing kits to be able to do that increased testing, we're going to actually test even more people in Forest Heights, as well as the other long-term care homes. And then we're going to see, hopefully, I know that sounds strange, but hopefully even more cases detected. And then we're going to see the effect of the measures that have been put in place to reduce the number of cases. So part of the reason that there has been such an emphasis on increasing testing in these homes when there's been the beginnings of an increased supply is precisely because of that, because it can spread so quickly in the homes. So I'll leave it at that, but hopefully that gives you a sense. It's not unexpected what we've been seeing.
Thank you, Hsiu-Li. Anything else?
I have a question quickly, if I could.
Yeah.
Are you able to give us, you talk about the increased tests that we'll see happening starting today. Are you able to give us a number of how many, or at least a percentage of how many more tests we'll start seeing today?
No, I'm not able. That's a very fluid number, and it will depend again on, real-time actions by healthcare providers in those homes right now. But we have an expanded ability to test. And so my understanding is the homes are going, we've worked with them, and we've worked with primary care partners who are also lending a hand to help us with the increased testing that's going on. The assessment clinics at the hospitals have also increased their capacity to test. So we've set up everything in order to be able to take advantage of the increased testing, but I can't give you numbers per se. They'll eventually show up on our dashboard in terms of numbers tested, though. Thank you.
Okay, so I think we'll wrap up this media briefing now. I want to thank all of you again for joining us today and for continuing to help us put out timely COVID information into the community. It's very important to us, and we know it's important to all of you. We wish you a safe weekend, however you're going to be enjoying the weekend. And we will be back on Monday with another media briefing, so we'll see you then. Take care, everyone.
Thank you, everyone. Thank you, Chair Redman. Thanks, Julie.